Okay, protocol number 4. This is chronic pain. So we would have done step number 1, body balance, 2 inches below the belly button or 2 fingers, right? We're going to reset the body, bring it back into balance. Step 2, we would have come into the nerve root. We would have lasered that for about 80 seconds to bring the nerve all the way up as high as we can. Again, you can't have healing or immunology without the neurology. Now, it's 72 hours or more, so now we've gone from acute pain to chronic pain. So we're going to use a little bit different settings, but we're going to do the same thing as acute pain. We just have a little bit different settings in there for you. So we're going to do the area. Again, it's best on skin, but for demonstration purposes, you're going to see that we have both an infrared, which is here, right? A lighter beam because you can't see the infrared, but we use red in conjunction with it so you can see where you're going to go. So we're going to paint the area. So we're going to do his hip. You're fine. You're just relax. Don't hurt yourself there anymore. So you're going to see a big scar here when we come to doing some scar revisions and breaking up some scar tissue. And we laser just like this right over the incision while the bandage was on there, and so it really came out nice. So again, what we're doing is we're lasering, we're painting the area with infrared, which is really great, I think, more for the acute situations, but I like it because it calms the nerve down. It really seems to calm the nerve down. So we have the ability to do both, a combination of infrared and red. So we're going to continue to do this, and later on, we're going to get to step 4 while we laser, while doing activation, myofascial release, tapping this, having him input into us, pushing up into it. So just raise your leg for just a little bit for me, Sam. There we go. So I'd be doing things such as this nature where we start doing some strain, counter strain. A lot different than it was about 6 weeks ago, wasn't it?
Absolutely.
So now we're going to go from red. So we couldn't even bend this knee. It was so much swelling in here that you couldn't even bend this. So really, really great results here. And again, we're going to do activation doing some of these protocols as well. But for right now, we're just doing the large area, started below the belly button, nerve root, and now the area of involvement, AOI, area of involvement. So really important for us to get in here, and again, skin is best, but we do have some nice light material here, and of course we have a light cotton. We don't want to be going through jeans or leather or anything like that. You may need to put some people in some gowns if they come in and they're not appropriate to where you want to be. So really important for us. So we're going to laser a big area. Now, I love this laser because it has quite a bit of power. I could put this on a stand. I wouldn't have to necessarily do that. Or I could put the patient to work, right? They're cheap labor. So get them involved, get them active in here, have them laser in their own area, or I'll put them on a stand, have him laying down, and be lasering. That way I can be doing myofascial release, I could be tapping it with an adjusting gun, I could be doing multiple different things.